All right, let's talk about something you've probably had done at a checkup, maybe without even thinking much about it, the blood glucose test. But what does that number they give you actually mean? Well, today, we're going to pull back the curtain on this super common test. We're breaking down what it is, why it matters so much, and what it can tell you about your body's personal fuel gauge.
You hear the term blood sugar thrown around all the time, right? But what is it, really? I want you to think of it less like some random number on a lab report and more like the fuel gauge in your car. It is a direct, real-time indicator of how well your body is managing its main source of energy. Okay, so here's our game plan. We'll kick things off with the basics of your body's fuel gauge. Then we'll get into what happens when those levels go a little haywire. We'll cover whether you might need a test and what to expect if you do. And of course, we'll dive into how to make sense of your results and wrap up with how to monitor your health. First up, let's talk about that fuel gauge. Before we can really get into the nitty-gritty of the test, we have to understand what it is we're actually measuring. So, what in the world is glucose? It sounds complicated, but it's actually pretty simple. It's a type of sugar that comes from the food we eat. Just think of it as the high-octane fuel for your body. It is the main source of energy that powers, well, everything, from your brain firing on all cylinders to your muscles moving. And this is where it gets really interesting. See, it's a two-part system. If glucose is the fuel, you can think of the hormone insulin as the key to the gas tank. Insulin is what unlocks your body's cells, letting that glucose move from your bloodstream into the cells where it can actually be used for energy. Without the key, the fuel is just kind of stuck on the outside, unable to do its job. But what happens when this really elegant fuel system gets out of balance? That brings us right to our next section, when levels go wrong. So things can go wrong in two main ways. On one hand, you have hyperglycemia. That's a fancy word for high blood glucose. It means there's way too much fuel just circling around in your blood, but it can't get into the cells. And on the other side, you've got hypoglycemia, or low blood glucose. This is when your cells are literally starving for the energy they need to function. And look, these imbalances are no joke. When you have high levels for a long time, it can be a big red flag for prediabetes or diabetes. If that's not controlled, it can lead to some really serious stuff, like heart disease or nerve damage down the road. And while less common if you don't have diabetes, severely low levels can cause immediate problems. We're talking confusion, dizziness, and in the worst cases, even seizures. So all of this naturally leads to a pretty important question. Do you need a test? Let's take a look at the risk factors and the symptoms that might make your doctor say, let's check this out. Your healthcare provider isn't just guessing here. They're looking at a pretty clear set of risk factors. Things like your age, your weight, whether diabetes runs in your family, and even how active you are. All these things can paint a picture of your potential risk. This is all about being proactive and catching any issues before they become bigger problems. And it's not just about risk factors. A lot of times, your body will send up some flares, some warning signs. If your blood glucose is high, you might notice you're super thirsty or running to the bathroom all the time. Maybe you're tired, or your vision is a bit blurry. That constant thirst and urination, that's your body literally trying to flush out all that extra sugar. It's a clear signal your system is struggling. Now, on the flip side, the signs of low blood glucose are pretty different, and they often hit you a lot faster. Feeling shaky, almost jittery, sudden, intense hunger, getting dizzy, or even a racing heartbeat. Those are your body's alarm bells, screaming that the fuel tank is on empty. Okay, so let's say your doctor recommends a test. What actually happens? Let's demystify the whole thing in our next section, what to expect. The best news is that the process itself is usually super straightforward. For pretty much all of these tests, it's just a simple blood draw. A nurse or phlebotomist takes a small sample of blood from a vein in your arm. Yeah, you'll feel a little pinch, but it is over in a flash. But not all glucose tests are created equal. A fasting test gives you a baseline reading after you haven't eaten for a while. A random test is exactly what it sounds like, a snapshot at any given moment. The A1C test, now this one is really powerful. It gives you an average of your glucose levels over the last 3 months. It's the big picture view, It smooths out the daily ups and downs. And then there's the oral glucose tolerance test. So that OGTT is a bit more involved. Think of it like a stress test for your body's sugar processing system. First, they take a blood sample while you're fasting. Then you drink this really sweet liquid. After that, they test your blood every hour or so for the next couple of hours to see exactly how your body responds to that big sugar load in real time.
All right, the test is done. Now for the part we're all really waiting for. Let's talk about understanding your results and what those numbers might actually be telling you.
So you get a high result. The first thing pretty much everyone thinks of is prediabetes or diabetes. And yeah, that is the most common reason. But, and this is a big but, it's not the only reason. Other things can push your levels up, like an overactive thyroid, issues with your pancreas, or even side effects from certain medications, like steroids.
And what about low glucose? Well, for people who have diabetes, it's often tied to their medication or maybe a change in their diet or exercise. But for people without diabetes, a low reading can sometimes point to other things, like underlying issues with the liver or kidneys, or even malnutrition. Okay, if you only remember one thing from this entire explainer, please let it be this. Your test result is just one piece of your health puzzle. A number by itself never tells the whole story. It is absolutely 100% essential to talk through your results with your doctor or healthcare provider. They're the ones who can put it all into context for you. And finally, for anyone who gets diagnosed with a condition like diabetes, the journey doesn't stop at the doctor's office. It continues at home. So let's jump into our last section, monitoring your health. So when you're keeping an eye on things at home, there are basically two main tools in the toolbox. You've got your traditional blood glucose meters. That's the classic finger prick that gives you an immediate snapshot of where you are. And then there's the newer tech, the continuous glucose monitor, or CGM. That uses a tiny sensor to automatically track your levels 24/7, giving you this incredible, dynamic movie of your body's patterns. And really, that's what this is all about. It's not about being scared of numbers, it's about empowerment. It's about being informed and taking charge. Knowing your numbers is power. So as we wrap up, I'll just leave you with a question to chew on. What's one small, proactive step you can take for your own health today?